Mike Wilson here, the host of the Stutter with Confidence podcast, and excited today to be joined by soon to be in a year or so, Dr. Katy Garcia. She's going into her fourth year of her medical residency at
Oh,
Texas Tech
medical school.
Medical School. I'm sorry. That's
No, you're
my
totally
mistake.
fine.
Residency comes after your graduate of medical school. Yes, yes. Um, my fault. So going into the fourth year of medical school, and she's hoping to become an orthopedic surgeon if the chips fall where she wants them to, which I'm sure they will. And so happy to have you today, Katy.
Thank you. I'm so glad to be here. This is like a topic that's very close to me. And also, I really like to connect with people who stutter. Although you cannot tell right now, because my fluency comes in waves. Right now is probably the most fluent I ever am, and it's lovely, but it's not like this most of the time. A lot of times it's very like, I like to describe it as like sort of like a case of like the hiccups, but with words, like where you're just trying, but you're repeating or you're prolonging. It's not, it's something that you can control to a certain extent, but it really varies. So yeah, I always like to connect with people who stutter because we're rare. And I think that you can gain a lot by talking with people who relate. And just sometimes you'll learn these little like tips or tricks or something that makes it less worrisome for you to speak. And I think that that's incredibly valuable and something that like I love to share and learn.
Yeah, and that's interesting that making it less worrisome to speak. Is it well, I don't know if this is something that you've had a chance to think about, but you
Oh,
know why it makes it less
yeah.
worrisome to hang out with other folks that stutter? Like, why does it make us less worried maybe about our speech?
I think it's because like I've thought about this extensively, because I wasn't always as comfortable with my speech. Again, right now it's great. It's typically not. And I feel like some people who know me and see this will be like, huh, really? Look at Katy. Because a lot of times it's like, my name is very hard to say, the k for Katy. So I'm like, Katy, but I think it's like worrisome for us because again, this doesn't really make sense, but I feel like it's kind of intuitive to a lot of us who stutter. Um, you don't want people to know. So you're trying to speak and you're trying to maybe pick words that are easier to say, or you're trying to just like you're like praying for fluency. Um, and sometimes you're fluent and people have no clue. So you're able to pass as somebody who's fluent, which is nice. It's nice not to have like an insecurity of yours just like right out, like as soon as you meet a person. So I think that when we speak with people who stutter, it's like, hey, I do and you do, and no one's trying to hide that. So it's very freeing and relaxing.
And you were saying that things are flowing right now to a greater extent than
Oh,
than
it's
typical.
incredible right now.
And is that because well, partially because again,
Mhm.
I stutter. Uh, that's sort of that's literally what
Yeah.
has brought us to do this podcast together. So and that feeling like you don't need to hide and that you're not trying, that you're making no effort to hide. If you stutter, great,
You
we're supposed to
stutter.
be stuttering with each other, that sort of thing.
Yeah.
Is that perhaps where it comes from? Is it the performance? I think of it as how it feels to me
Mhm.
historically is like performance anxiety, right? When I
Mm,
most
yeah.
am worried about my performance
Mhm.
with my speech,
Yeah.
the more likely I am to struggle with my speech when I don't give a what,
Yep.
whether it's talking to the dog or oftentimes to somebody else that stutters or maybe a baby,
Yeah.
it can vary a little bit from person to person, but is that
Yeah. Yeah.
central?
Yeah. I think that you really got to the core of it. So I feel like sometimes um like at my baseline, most times I'm going to stutter. Like I have two cats, right? One is Schmidt and one is Honey Badger, HB. And Honey Badger is always very hard for me to say. I exaggerated it now with how I typically speak, because again, I'm fluent right now. But I feel like in general, at my baseline, I'm going to stutter. Um, and that's something that's like really interesting. I've read that when you look at the pattern of speech waves in people who stutter, even when we're fluent, um, our phonation, like the waves that we make, aren't normal speech, you know? So at our baseline, we're prone to stutter. Some days are great, some days are really bad. And then if you add on just a little bit of stress, it's going to make it worse. Now, if you add on a lot of stress, it makes it sometimes it feels impossible, or not impossible, but I'd say it's like physically exhausting, where you're just trying to speak. And speech is something that a lot of people take for granted if they do it well, I guess. If it's something they've always, been able to do. I like to relate this to ortho, because I think that a lot of us, our muscles, our ligaments, our bones, they feel good, or they don't hurt, and then we're hurt, and suddenly it's like, oh well, this is something that's very important. It's the same thing with speech. So I lost my train of thought. Oh, our baseline, like just there's just a lot of things that go into it. And speaking itself, especially for people like us, if we want to be fluent, which is, I mean, most of us, if not all of us, want to be fluent so that we were not different. Um, if you like really try, and if you apply things you've learned in speech therapy, which I've been to many times, um, you really have to, breathe a certain way, have your mouth positioned a certain way, very relaxed, start your phonation a certain way. And it's something that's, it really takes a lot of mental energy. Um, it takes a lot of focus. And then if you're already stressed, I mean, naturally we tense up. And then already it's harder to have that relaxed position for perfect speech.
Right. And what I found also with all you know, the speech therapy I ever had,
Mhm.
um, other than the one that focused, at least for one semester when I was in college, on just eye contact and
Yeah.
just non-avoidance. So
Yeah.
that
That's
one,
big.
yeah, that was huge. And I mean, a huge step in my journey was just was learning to face that thing that I was so freaked out about, which was what are people
Yeah,
going to think that I'm
exactly.
stuttering, right? And when I'm looking at them, it's like, you know,
Mm,
see
yeah.
everything.
You can read their face, and that moment of confusion at first, like Are they okay?" I'm like, "Yes, I'm fine. I'm just trying to speak. This is the way that I speak." Yeah, I totally can relate to and understand that.
Well, and I felt like that kept me present. It kept me in the
Mhm.
communication,
Yeah.
even if the communication was paused because I'm, battling through a word, it's still clear between me and the listener on both sides that I'm still talking,
Oh, yeah.
that, just,
Yeah. You are engaged, you know?
right, right. Whereas when I'm looking away,
Yeah.
having a block, they're like, is he still talking to me?
Mhm.
What's going on? What am I supposed to do? Also, when we look at people, it sort of lets them know, I think, what they're supposed to do, sort of, like,
Yes.
hey,
Yes.
I'm still t- t-
Mhm.
talking here. Just hang it in there with me, right?
Yeah, that's
And
very true.
where's going to come,
Mhm.
That's-
Yeah, no, so it's become a little bit or like what I found this past year, because like our first and second year of medical school, it's all like books and studying, right? And then our third year, we go on rotations in different specialties for like a certain amount of time, right? And then like with COVID, we had to wear masks. And so as somebody who stuttered and somebody like fresh into pretending to be a doctor because that's what I felt like. Yes, you were training, but I felt like I was playing doctor, right?
we used to
So,
call it in dental school, we used to call it fake it till you make it.
oh yes, like that is something that I live by still. Like, we are going to just pretend we got this until we do. Yeah. But with mass, like it became just so much tougher for people to tell that I was trying to speak. Because for me, my stuttering, most of the time, it's blocks or prolongations. And sometimes, like, I'll like be making a sound, but it's very like faint to the listener, because it's stuck. So if I'm like, hi, and they can't see my mouth, then it's harder. Um, and something that I learned, like, well, I knew this, and something like I practiced like for a couple of years before this, because I didn't like really start to accept my stuttering until maybe like 23, 24, and I'm 29 now, and I've stuttered my entire life. So, I mean, most of my life so far has been spent like trying to pretend that I don't. Um, and in the hospital, something I began before, but especially with COVID, um, like if I was like stuttering and blocking or something, and a patient's like, "Oh, are you okay? Like, what's going on?" I would like pause, and even if I stuttered a lot through this next like phrase, I'd say, "Oh, hey, so I stutter. It takes me a little bit more time to say things, if that's all right." Um, I only add if that's all right because I'm in a setting where if a person thinks that it's going to be difficult for them to understand me, at which point, like I would readily, excuse myself and get someone else who could communicate with them better. But that's just specifically about patient care. In general, it's,
Katie, if
hey,
I
I
can,
stutter.
I apologize for interrupting.
Sure, no, no, you're
You know,
good.
because I'll forget about this. But I think that's a very, very interesting point. It's a very interesting question, right? As to how
Mhm.
to deal with that. And I'm not saying there's a right or wrong, obviously anybody can handle this how they want to. In my case, you know, exactly like you handled it is the way and I had a I call it a better stutter going back, certainly when I was in dental school and up
Mhm.
until a few years ago
Mhm.
when I found an approach that really agreed with me. But basically, if they were confused, I would say exactly what you said. I have a stutter, so it's going to take me a little bit longer
Mhm.
sometimes to get words out. Now, and this is where the nuance is, so I chose not to say that next line
Yeah, which I
if
typically
that's okay.
don't, just the setting.
They are always free, and I would say that patients know that they're always free to request a different
Mhm.
provider if they want it,
Yeah.
because that's the modern world of medicine, right?
Mhm.
50 years ago, they would have probably had no choice in most cases.
Yeah.
Like, this is your doctor, just shut up and listen to your doctor, sort of.
Mhm.
It's not like that anymore. Um, but but yeah, so that's a nuanced point, and so um, real quick on that point, um, do you think that by saying, if that's okay, like implying that, well, if you want somebody that doesn't stutter, that's fine, that does that make you feel at all sort of less than what you would if you didn't have the stutter? Or am I
Yeah,
reading too
so,
much into that?
you know, since it's not something that I would typically like say in like non-work settings, like I really take, the is that okay approach like specifically to work. And this is because like, and it's something that I just recently became aware of. Like there are some people who are hard of hearing, and so I like to think of it as, hey, like maybe like it actually is very hard for them to understand me with my broken speech. So
That's a great point.
yeah, like um, even if they could comprehend me really well and just chose not to, I really try not to take it to heart. However, I've never had a person say, oh, no. In general, if you tell someone, like, hey, I stutter, it takes me a little bit more time, um, it kind of like puts it back on them, and they don't want to be a jerk so explicitly. So they typically won't say, like, no, it's okay, or oh, well, that's weird. It's like, oh, they're addressing this to me directly. And if I don't respond in a socially appropriate way, then I'm going to look bad. I'm going to feel bad. So I really think that just saying it is good for everyone.
I agree. And I would actually, my opinion, and from what I've seen, it actually does endear you
It
to a lot
does.
of people,
It does.
and it can increase the trust level.
It does.
And I just had a chat recently with the head women's softball coach at Oklahoma State.
That's super cool.
Uh, and he said that. He said, I think my stutter actually, he's like, I never thought I would say this when I was
I know,
younger, but
but
it
it's true.
endears me to people.
It does.
And it's not just, I think some of us with the below the iceberg history of
Mm,
shame and embarrassment, we jump to the, oh, well, that must just be people like patting me on the head, like, oh, I'll be nice to the poor stutterer sort of thing. But I
mhm,
don't think,
I think it is.
look, I'm not saying it's never that, because I'm not in everybody's head, of course. I don't
Mhm,
know. But I think in the vast majority of cases, from my experience,
mhm.
it makes people it can make people trust you more because you're being honest about something that, must be,
Mhm.
you know, not that easy for you, sort of thing. And you're just putting it out there,
Exactly.
and it's showing your vulnerabilities, right? You're not just the perfect doctor,
That is
everything's
a big
perfect.
thing. Yeah. Like, so like that last thing you said where like you aren't this perfect blah blah blah, right? As humans, like interestingly enough, I feel like just our nature is not to really like or trust people who are perfect because well one like it makes us a little bit more aware of our own flaws. And also it's like, well, you're perfect, so you can't relate to my struggles. And I think that was stuttering, and like with an insecurity or with like a like defect or something, wrong, that's just so blatant. Yeah, like it really, you cannot hide it. And I think that sort of creates, yeah, like a sort of trust, especially with patients, because as you know, it's kind of weird when like, well, it hit, you may or may not know, but like, when I first began to interact with patients, I really began to appreciate how vulnerable they are when we first meet them, like they're trusting us with their health, and we are people that they don't know. And it's just blind trust. And that's weird, you know? But if you share like a little bit about yourself, which in our case is speech, it's like, hey, you know what? Um, maybe they're human like me.
Totally, totally. Yes, that ability to relate. And
Mm,
yeah, and that's, I mean, it doesn't surprise me at all that every time you've said, if that's all right, they were like, sure, that's
yeah,
all right.
okay.
And that was my whole, um, all the tens of thousands or hundreds of thousands of blocks that I had
Oh,
with
yeah.
patients, over the years. I probably tens of thousands, because it wasn't that long. I'm not that old, but but nobody ever had. I mean, there was one time when a guy was clearly like high on something,
Mm,
and he's like, I just can't do this. I need somebody that can talk. And like, all right,
yeah,
but
well, in
but
that case, like they're not in their right mind.
right,
So
right. That, and the way I look at it, I mean, I know that the vast, vast majority of people from experience
yeah,
will totally be cool. The vast majority of adults, maybe not, 11-year-olds on the playground in the sixth grade. That was a little different.
yeah, that's different if you are a kid too, that's where it's trickier. And sometimes like I wonder, if I had like if I was as comfortable with my speech now, um, as I was back then, like how would my life have been? Like, and to be fair, like I've um I've always had friends. I've never been somebody who's really been uh quiet because of my speech. But I attribute that to my parents and just really like instilling in me like, hey, you are smart, you are worthy. But I wonder like, what if back then when I was like 15 or 16 or whatever, if I was like, hey, I stutter. And yes, some people are mean, and especially, at those ages where everyone's a little uncomfortable in their own skin. And but I personally think that like with bullying, it can be like it's reinforced when we react, when we're like really upset. And I had that with a patient once. So before I went to medical school, I like got a master's in clinical psych. And when I was doing my like my practicum or clinical hours for graduation, I one of like the weeks I was working in an inpatient group setting with teens. And so like I was talking, and there was a teen who just kept on mimicking me, right? And I mean, of course, like these are children um, who have endured a lot, So like I'm assuming that it was like a power play, I'm pointing out your flaw because you're in charge and like I'm better or whatever. So like he kept on mimicking me, right? And I stopped. I'm like, yep, you're right. I sound exactly like that. And he stopped and he's like, yeah, you do. I was like, yes, I know. And then it just like uh he was like, oh, well, okay. And we sort of just moved on and he stopped. I don't know that everyone would react in that way, but I always think that story's funny because he was really attempting to make me upset. And I was like, well, if I just don't react, you won't be reinforced.
And that's a great story, and that's a great way to handle that. And it brings up a question when you mentioned the clinical psych, and that was grad school, right? So
Yeah.
after, and you went to undergrad at Stanford, and then after that, you did a master's in clinical
Yeah.
psych.
Yeah. When I finished up my bachelor's in psych at Stanford, I was like, what do I do with my life? And so I came back home for a little bit, like while I figured it out. And then I was like, there's a university down here, UTRGB. I'm from McAllen, Texas. It's a city on the southern border of Texas and Mexico. And I was like, well, there's a university here. They have a master's in clinical psych. I think the clinical psych is really cool. So I decided to stay and I applied and I got in.
And that was sometime you mentioned that like 23 or 24 is when your journey started to, not be uh, as focused on hiding your stutter and
Yeah.
starting to come out of the closet. Was that at all related to the fact that you were studying psychology and thinking about these things a lot?
So actually it wasn't, but that's because because I was enrolled in a program at that school, they also had a grad program there for speech therapy. And so because I was enrolled in school there, I could get the sessions for free. And at first I sort of like resisted even the idea of going to speech therapy. I think the part of it was like deep down, and psych like maybe didn't help me like really like address that like it didn't help me accept it. Like I had some help with speech therapy for that, but psych like really gave me the tools to be self-aware. Um, so like I really think that like deep down, I sort of had maybe a lot of anger, um, because like I had this like great life, I graduated from like this fancy school, but like I have this thing about me, and as soon as I speak, people know what's wrong, and people are judgy, and like at that time, I felt like I would get a lot of looks like, oh, she must be stupid. And like, I always knew, like, hey, I'm not. I went to Stanford. So I think like my like speech, I had a lot of anger about it, as well as like embarrassment. But I began to go to speech therapy, and so like my grad school took 3 years. So I went to speech therapy all 2.5 of those semesters. The first half or the I'm sorry, 2.5 of those years. The first semester I was like in a contemplation mode, like I shouldn't. Um, and then like that first year of therapy, um, I definitely like encountered some situations, with some of the speech therapists and supervisors where um, their intentions were good, but I think that I was angry. So like, and I felt like they couldn't understand me because they weren't people who stuttered, you know? And like, so, like one instance, like I specifically remember is they were trying to teach me like, this easy onset and gentle onset technique, which most of us who have ever been to speech know exactly what that is, you know?
Yes.
And yeah, we love that one. Um,
It's
and
curious why that's still being taught after all these years when every person that stutters I know says it
doesn't
doesn't hold up in the real world at all.
it, it it's just so much work, you know? Like with every syllable, you have to do it in this certain way, and it's exhausting and it's not sustainable. Um, but like this one instance, like I remember, you know, because like they were having me like practice like first the syllables or sounds and the syllables and then like the words, right? And they like watch you and listen and like correct you. And this one time, like I remember like again as somebody like who went to speech as like a little kid and then like again in high school and then again as an adult, you know, like I've been through the ringer with this stuff. Like, has it fixed my stuttering? No, but I know how it works, you know? And I remember like
It's
that
not
I was
it's
really
not
what?
rocket science, right? It's
Oh
not rocket
no,
science. It's
no, no.
always
It's
seemingly
it's
a
really
version of
not.
the onset with what most of the speech therapists are doing.
Yeah, exactly. And like they were watching me and they're like, no, you're doing it wrong. Do it like this. And they modeled it. And I just remember that they modeled it like completely wrong. Like, say that I'm saying the word water bottle, right? And like, if I'm doing this technique, it's like water bottle, you know? And I remember that they were like, water bottle. And I was just angry. Like, I've done this so much. I know exactly what this is. And yes, I'm fluent on these words, but I like you were teaching me and you have not yet like had the training to master these techniques because they were students as well. Or they were in grad school. But then I had a speech therapist, I guess my second year of therapy, who stuttered too. And oh man, like that just changed it all for me. Yeah.
Nice. So
Like,
that was way, way more useful for you.
yeah, like, and you know, of course, like we worked on techniques because she had to do her like curriculum and training. But what she did was like she'd be like, okay, you know what? Today we are going to go out and walk on campus and ask people for directions. And I'd be like, oh, I mean, but I know where stuff is. She's like, no, you were going to just go and be like, hey, where is the gym? And I was like, okay. And just like she really forced me to just talk to a lot of people and have a lot of interactions. Like, and she was there like as like my like safe base, you know? So if I stuttered really badly or people reacted, you know, like those interactions were very brief. And then like I would finish up with them and then we would like walk off, you know, and debrief. She was like, hey, so what do you think went well? Like, what do you think could have gone better? Hey, I saw like that person, you know, was making a face. Like, tell me about how that made you feel. So that like I guess ties back into psych where the like talking and like really like exploring, you know, those emotions that are related to stuttering. I think that made all the difference for me.
Yeah. That makes total sense. And like I said, my journey was impacted in a huge way by doing that same thing. Just
Yeah.
brought around, and to any, I have, you know, gone to speak, as a person who stutters at several, um, basically they call them fluency classes in the speech language pathology grad programs,
Oh yeah. Yeah.
speak to a
So
class.
same exact thing.
And, that's something I tell people, look, if you're going to work with folks that stutter,
Mhm.
at some point you got to get them out of the clinic. It does
Yeah.
nothing to sit there and practice your words forever in the clinic in the comfort zone. That's not where the performance anxiety is. That's not,
Exactly.
and that's not where the progress ultimately needs to be made. Where it needs to be
Yeah.
made is, you know do you increasingly realize that stuttering really is okay, that it's not the
Yeah.
world, that we're free to stutter.
Yeah. And like like on that note, like yes, it's okay to stutter, but it's also okay when people don't react well, you know? Like, and I think that that's like like a really big part to accepting your speech and stuttering freely, where it's like, hey, like there are going to be some people who don't react well. There are going to be some people who make me mad or who hurt my feelings. And you know what? Most times these people are fleeting. These interactions are fleeting. And if they're not, then if if you can choose not to keep their company, you probably should not. So there like it has a lot to do, I feel, with like self-respect, and like tolerance of reactions that aren't good. Like, hey, well, that was weird. Moving on.
I agree. And for me, going back to that
Mm,
anger question, I needed to learn to basically not hang on to that anger, right? When
yeah.
someone has a moment where, they reacted wrong,
Mhm.
you start stuttering, they don't know what's going on, maybe they chuckle at first, or maybe they are like, have a look
Yeah.
that, they
Mhm.
didn't mean to make that look, they were just confused as what, so they made it. And they didn't have the perfect reaction, but it's sort of like that, forgive them, they know not what they do,
Yeah.
thing, right?
Yeah. It really is. Like I have this story. Like I have a couple of like stories throughout my life that I think were very defining as uh, well, as a person who stutters, but also like just as like me. And like again, like most of those interactions are fleeting, but sometimes they're not. And I remember when I was a sophomore in high school, oh, like the story, I'm always just like, this person, this situation, everything about it was awful. But like we were, like how when like in class, like you would like read a paragraph or a sentence or whatever, and then like move down the desk, like rows. And this is something that most people who stutter dread. For me, my speech is always worse when I read, go figure. And like again, like I was a sophomore in high school, like I was in a bunch of AP courses. I was like ranked like 2. And like like my like I would comfort myself with like the fact that like yes, I stutter, but I was also like intelligent. Um, and I think like that was something that like I valued a lot. And so we are reading in class and like it gets to me. And this was like I mean, it was like something on like Lincoln. Okay. And so I'm trying to speak and my stuttering is awful. And in high school it was very bad, like exhausting to speak. And I couldn't get out a single word, you know? So I was like, the, you know, and like this like teacher, and it was also like the first day of class, of course. So they didn't know me yet. Um, like they would like scream out the words while I stuttered, like the president, the president, like, and I'm stuttering, and I just remember my face getting so hot. I was just angry, but also hurt and really embarrassed, because most of the people in my class knew me from previous um, courses, right? And nobody bothered me about my stuttering much because they knew me, like, and like they knew I was smart and I was nice. So why mess with her, you know? But he didn't know me yet, and he was like screaming out these words, like as I'm stuttering. I'm getting so mad, and then he makes a joke like, "What? You can't read?" And I just remember losing it, like I I, I lost it like in public, and like I like was like crying, but like the kind of crying where you can't breathe and you're like you know. But also like I was like raised to be very, very respectful, like um I mean, in hindsight, like I totally get that this person was clearly not being very kind to me, and had I reacted in an angry way, it would have been understandable, you know. But I was like raised to be like very, very respectful, you know. So I'm sitting there and I'm angry, and like I like don't respond, um and then like the class was silent, and they like looked at me and like him like just shocked, like what happened, you know. And so someone explained like, hey, she stutters. And he's like, oh, okay, fine. So move on. And they brushed it off. Um, and I just sat there in the rest of the class, really mad. At one point, like I like asked to go to the bathroom, and he was like, yeah, sure. Or they were like, yeah, sure, go. And I was like, but I was so mad, and like I was like just like in tears and loud, you know, like you could hear me as the rest of the class was going on. Um, and like I went to the bathroom, I called my mom, and I was like, hey, like this it happened. I'm really upset. Like, and she was like, oh my God, what? Like a person did that to you? And yeah, so you know, she came in, she like met with the principal, and like the principal knew us well. My brother went to the school too. The principal was like shocked. And so the principal talked to the teacher, and the teacher was very like prideful. And so like I was just fuming, and I wanted an apology in front of the class because they embarrassed me, so they should apologize to the people they embarrassed me in front of, which I think was fair.
The,
But they
the guy
refused.
who was doing it, right?
Yeah, yeah. But they refused, and I was told like you can switch out of that class, but it won't be AP. I was like, oh, well then I won't get to take the AP test, and like I won't get the points towards my GPA. So I stayed in that class, and all year I hated them. But within a couple of weeks, they realized that I was one of the few people there who did their work, who paid uh, uh, attention. And I mean, by the end, like they adored me. I did not like them still. But like that was like a story that I think like just blatantly like it gets to the heart of like what it's like to be a person who stutters and you're in a situation that you really wish you could change, but you can't. And it sucks. And I mean, I would not wish that on someone. I would not wish that on myself, but I'm okay. Like, I mean, look at me now. It was terrible, but it's okay.
So we can all, I think, relate.
Oh, I'm sure.
Um, and, I know that I didn't have that exact situation, but I had a situation where I was supposed to give a speech on
Mhm,
Genghis Khan
mhm.
my first year of high school. And
History, man. Like there's something with that class, huh?
that's where the presentations were happening, maybe at that
Ah,
age.
true.
Um, so after dreading it well, from the moment that I heard I was going to have to
Mhm.
give the presentation, and even though it wasn't the first day, by the time I gave it, nobody knew me because I didn't talk.
Um,
At that stage, I didn't talk. It was a new school.
mm,
Well, the year before was middle school, my first year
mhm,
living in Atlanta,
mhm.
and so nobody knew me. Nobody knew I stuttered in that class, and I was doing everything I could to make sure they didn't know. And I
Yep.
was severe, so the only way that was going to happen is for me to, you know, zip
Mhm,
it. And so I get up to give the presentation on Genghis Khan, and I say Genghis Khan was,
mm.
and I couldn't get outborn. And in those days, I hated the sound of my stuttering. So
Oh, I
something,
know exactly what that's like.
so I would silent block, right? I decided no sound's going to come out
Mm,
until it comes out right, quote unquote, because I
okay.
hated that, the whole
Mhm,
sound of it. So I
mhm,
silent blocked on born. I said Genghis Khan was, with just a ton of
mhm,
tension on my face
mhm,
for probably 2 minutes, just
mhm, mhm.
right. And those are just listening to the audio of this, they can't see it,
Yeah.
but a ton of tension. And it's in retrospect, with a bunch of 14, 15-year olds, I'm surprised nobody said anything.
Yeah.
But in my mind, they were all thinking, what a freak show.
Mhm,
This is just the weirdest thing I've ever seen in my life. That's
mhm,
what I assumed everybody was thinking. And so after like 2 minutes of silent blocking, I just sat down in total shame, never looked at anybody,
mhm.
and just braced for it to spread around the school like wildfire. What had just
Yeah.
happened. I assumed that this was just going to
We
spread.
assume.
Yeah.
Mhm.
And as it turns out, in retrospect, from talking to friends later, it actually, most people still didn't know that I stuttered. Like, I think people just were probably confused as heck as to what just happened.
Yeah.
Although they were 14, 15, they might have figured it out eventually. This guy's got sort of speech impediment. Something's going on here.
Mhm.
But yeah, so, and that was, um, one of the worst experiences of my life.
Yeah, we have those moments that are because of our speech, and really like sit with us and like something that we like as adults now we reflect on.
Yeah, absolutely. And it's a part of what binds us together, folks that stutter, though,
Yeah,
right? Because, I mean, I know people that don't stutter can listen to that, and they can empathize, and they
of
can,
course.
they can get maybe halfway there, or maybe one third of the way there to understanding, right? But you just
Mhm,
can't you can't fully feel it,
mhm,
like as you were telling the story, and probably anybody watching this podcast that stutters, of you trying to say that first word, and the
mhm.
kid doing what he was doing.
Yeah.
We just can feel it, like
Yeah, you're like, oh man, like I feel your pain, like that, like anger, that like shame, that frustration, and almost like betrayal, like of yourself because you're trying so hard. So for people not to know that you stutter and you're doing it in this very like blatantly painful way. Um, yeah, and just and looking back, well, I mean, my situation was interesting because somebody, the teacher, a person in power, was actively being the being the antagonist of the story, but 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 looking back, like just at situations like perhaps not that one, but other ones like where I was really embarrassed, and most times, like if not all of it, all the time, it like ties back into being afraid of letting people know that I stutter because I'm just trying so hard to pass as fluent. Um, so I think that there's just so much to be said for acceptance of stuttering. It's it really does make your life so much easier.
Yeah, I like to call it radical honesty.
Yes, yeah, yeah. I use that phrase, except instead of honesty, I say it's a radical acceptance.
Mm,
Like, oh, we're just accepting that this is who I am, and this is the hand of cards that I was dealt, and there's nothing that I can do to change it, but I can change the way I react.
right. And accepting it openly, right?
Yeah.
Not just inside of ourselves, like, oh yeah,
Mhm.
I know I stutter, I accept that I stutter,
Yeah.
but like, accepting it in the world and
Claiming it, Yeah, I think
exactly.
that's so freeing when you finally do. It's like this just weight is lifted off, and it's also something that you have to practice frequently, because even now, the there are like days when I'll find myself like trying not to stutter or like trying to pass as fluent, um, and on those days, like I'll notice like that I just feel drained and maybe I'm angry or I'm frustrated. And then like I think back, like, hey, what did I do today that was different from other days? Well, today I was trying hard um, to have people not see that I stutter. And then I'm like, hey, let's think back to days that are good. There are days when I'm just like, oh, I'm speaking. If I stutter, whatever. It's a process. It's not as easy as saying like I accept it and stating that you accept it. It's very active. Like it's a lot of work. It's hard.
I agree, but it's interesting, right? Because like you said, when you do it,
Hmm.
it's actually easier, right? Like
It is.
you don't you're not at war with yourself
Hmm.
internally, and
Yeah.
therefore you're not, sucking up your energy reserves through that inner war. You're just like, this is me. I stutter. I'm going to say what I want. I'm
Yeah.
going to do what I want.
Exactly.
It is what it is.
Mhm.
If you have a problem with it, well,
Oh well.
find
Moving on.
a person to talk to. What do you want me to tell you?
Yeah.
Because
Hmm.
it is what it is. And when you have that perspective, then you get that respect. You respect yourself,
Respect yourself, but
right?
also I feel like you earn it too, because um, I feel like a lot of people just can't imagine what it would be like to be a person who stutters. Like they see us and we're struggling, and it's a really bad day, and it's impossible to speak. And I feel like, well, I feel like what they think, but also like um, what I've heard from people who I've had this conversation with is a lot of times people think like I cannot imagine what it would be like to be that, because speaking is something that is effortless for most of us, not us, but I mean um, in general. And so I think just that that confidence, despite something that evidently is wrong, um, is something that people respect, because it's really hard to do.
Yeah, Well, and I like to call that the Stephen Hawking effect,
Ah, okay.
right?
Tell me about this. That sounds, I feel like I'm going to agree.
So Stephen Hawking, right? I mean,
Mm,
independent of his disability, was a great physicist,
phenomenal. Yes.
right? Like one of the top, I think one of the top, handful in the 20th and early 21st centuries.
Mhm,
So a superstar in his own right.
mhm.
But and you and I are slight exceptions because we have taken some physics courses, but even you and I probably never would have heard him unless we're, like
Yeah.
astronomy nuts, or we
Yeah.
never would have heard of him
uh,
if he hadn't been severely
mhm.
disabled, right?
That's
He
like,
is
yeah,
right? He's
that's
a
so
total
true.
legend um, because of his overall biography, which is that he was, severely disabled, I think starting in his 20s.
Yeah, so it started late, which makes it more astounding because it's something that you have or he had to learn to cope with. And in spite of that, he did these incredible things. And you're right, like there, there are people, I'm sure, who are just as incredible in the like in their field of choosing, and people in that field, they know them, they respect them, but the general public probably doesn't know who they are. But just the story that Stephen Hawking has is something that amazes us all because we cannot imagine, and they're accomplished, or they're accomplished and incredible on top of that.
Totally. And in a very real way, I think it's, if we're open to it,
Mhm,
whether we have a disability or a difference
mhm,
or not, seeing what he did and how he didn't choose to just,
mhm.
cry in the corner of the row, oh, my life's over. I was planning on being a great physicist, but now I'm disabled. I'm done because nobody's going to listen to me, respect me. I can't even, do basic bathroom activities by myself. Nobody's going to respect me. I'm done. I'm toast. He said, nope, I'm still going to be a freaking legend. I'm still going to be a great physicist, and it's not going to stop me, right? And
Yes, like, and that, um, but like he also was so public, he gave talks, he was in front of people. He made no sort of effort to hide what was going on, which makes him even more remarkable.
right, and I mean, he just, I mean, someone that can do that, and I think that's a part of why, through stuttering openly and going
Mhm,
out there and saying what we want, why
mhm,
we endear ourselves, one of the reasons why we can endear ourselves to people is it's clear to them, especially the more, pronounced and
yeah,
severe the stutter is, it's clear to them that this can't be particularly easy,
yeah,
and that you're, Dr. Garcia anyway. Like, it didn't stop you, right? So you
yeah.
sort of just, emit a level of courage and self-confidence,
Mhm,
because most people
mhm.
with a problem like this are gonna, you know,
Yeah,
not put themselves out there and go for their
it's
dream.
so hard.
It's
Yeah.
hard. It's hard.
Mhm,
And it's understandable why people
mhm.
don't, but it's also an
Yeah.
opportunity for us to
Mhm.
be, and some people I don't know, I think it's cliche, but to be inspirational, right? And to show other people, you know, the human spirit has power when
Mhm.
it believes in itself and it,
Yeah.
goes for its
And
dreams.
and I think like that, like especially now with technology, and being able to communicate to a broader reach, I think like it's really important um, to somehow like share our stories with people who are younger, and maybe they haven't had that experience of like, hey, like it is what it is, like I wonder, like, what if I, knew people who stuttered, because I didn't until I was maybe an adult, you know? Like like I guess I never felt held back, because my parents, like, they really, like, instilled a lot of self-worth. Um, but I remember, like, that embarrassment and that shame. And I wonder, like, what if I was able to see people who were beyond that, who accomplished their goals or did something incredible, and they speak like me, if not worse, and I really think that there's a lot of power in sharing experiences, especially with something like this where we're kind of rare. Yeah, so I love to connect with people who stutter, because I'm like, hey, you are a part of the club. It's a terrible club. I'm sorry, but I can relate.
Yeah. Although, yeah, it's a challenging club for sure. And we've had a
Oh,
lot of
for
times in our
sure.
life, right, when it was miserable. And,
Hmm.
I don't know that anybody will say having a big long block. I've never met a person that stutters who says having a big long
Yeah,
block is fun, that they
yep.
enjoy it.
That was great. No, no, it wasn't. It was terrible.
It was the best 10 seconds of my life, right?
Mhm.
Oh,
Yeah.
um, and speaking of connecting with people, so you have, from what I understand, a pretty sizable following on Twitter. And is it a lot of folks who stutter that follow you on
You
Twitter?
know, so um a lot of people I talk to are in medicine, but I think that's just a product because that's what I like, But like I maybe like 2 years ago or so, which also, like, I credit this to, like, my, like, acceptance, was I remember, like, that I made an intentional change to my bio, and I put a, like, line, "Person who stutters." And I remember, like, that when I, like, submitted that, and I was like, "Huh," like, and I don't think I had, a lot of people on Twitter at that point, like, so it wasn't like I was declaring it to the world, but it was something that I was just so open with, you know? And if anything, like, for me, that was like, huh, like, if anyone clicks on my name and they happen to read my bio, it's like, hey, person who stutters. And so like then like I began to sometimes like tweet like my experiences, and I noticed like that like I would get these messages from people like, hey, I'm a person who stutters too. And also, I never heard it phrased like, um, person who stutters. I've always heard like a stutterer. Like, I like person who stutters more. Like, me too. And like, just it's been about 2 years now. And sometimes like I'll like be clicking on bios or something, and like people I've connected with because of speech. Um, and I'll see that their bio is like I'm blank, and I'm a person who stutters. And I'm like, yes, we are claiming this, and this is awesome. So yeah, like, and like I've like had like some people in medical school who have reached out and been like, hey, I'm a person who stutters too. And I didn't know that anyone else in medicine was a person who stutters. Like, hey, it's so great to meet you. Or like I've like twice had two people who had like kids who stuttered, and so they reached out like and frankly like explained like, you know a as a parent, I have been concerned because this is something that it seems like they're gonna have for the rest of their life, and it doesn't set you up for an easy life. Um, and, like, so just, being able to communicate and be like, you know what, your kid is going to do great and they're going to be fine. And as a parent, I don't have kids. I'm sure that you're going to worry and stress, especially about this, but also they're going to be great. And they're going to be tough, incredibly tough. And it's not an easy way to become tough, but man, like we are a resilient group. It's very hard to knock us down. And just because we're so used to those like little things, and then you're like, no, it's okay, moving on. And I think that that sets you up for success if you really apply yourself to things, like to what you want. So yeah, I like for me, I think that Twitter's been great to speak to people who stutter and connect and relate.
That's super cool. And yeah, so and out of curiosity, how many folks in the medical uh, either that are,
Mhm.
doctors of one sort or another already, or who are in, medical school or, dental school or pharmacy school,
Mhm.
whatever the doctor path may
Yeah.
be. How many of those folks would you say that you know?
Okay. Give me a second to like think about them. Um, so there's a a surgeon. His name is Dr. Shields, and he does joints. And he is a person who stutters. And I I met him because I posted about a experience I had with stuttering. And someone else who I follow on Twitter wrote, and they're like, "Hey, have you met Dr. Shields? He's a person who stutters too." I was like, "What?" And then it turns out that the person who connected us, her father, and she's an orthopedic surgeon too. Her father was an orthopedic surgeon, and he was a person who stuttered his entire life. Um, I have a friend who's a second year in medical school at Harvard. He's a person who stutters. Um, so those are like the like really the like salient and recent ones. But I am going to say that I solidly know of at least 15, if not more, which I mean doesn't sound like a lot, it's 15. But if you think about how rare we are, um, and then that plus people in medicine, which is another like subset, it's actually a lot of us. And these are just people that I'm aware of. There are people, oh, you know what? And I recently learned about a person who apparently went to my medical school a couple of years back. So I didn't get to meet them, but they were a person who stuttered too. And like it inspired them to go into pediatrics. So now they're a doctor for children and they love to treat people with impediments. So we are common. And you, of course, you're in dentistry, so medicine too. I think that something about it like draws us, to that field.
There's at least two other people I know that stutter that went to the same dental school as I did,
Really?
NYU. None were there when I was there, as far as I know.
Oh,
Although, as we've talked about, sometimes folks that stutter are in hiding, so you might miss them.
mhm.
Um,
Oh yeah.
but there were two that came after me that I've been put in touch with that did the both stutter as well.
Mhm.
And, yeah, so it's clear, for all the parents watching this or all the kids watching this, thinking my stutter is gonna, uh, you know, prevent
Make
me
it
from,
hard, yeah,
yeah,
from
and
speaking to patients because, as people in medicine, um, a huge part of our job is speaking to people. And speaking is one of the, no, is the toughest thing when you're a person who stutters. And then if you tie that into your job, and even though like you may really want that job, you know, it just feels impossible, unmanageable, really, really hard, but people are doing it all the time. And I just thought of someone else that I know who stutters. He's a little bit more. He is able to pass as fluent a little bit more because his stuttering was really bad when he was a kid. He recently graduated from my medical school. His name is Bradley, and he's about to start a residency in ortho at Penn. Like just this incredibly and he is probably one of the smartest people I know. And although his stuttering was mainly as a kid, you know, as people who stutter, you can tell when someone is a person who stutters, you know, just the way they word things, you know, or his stuttering would be repetitions, but very quickly, and then he'd move on. But we were talking one day, and he's like, hey, you know, I'm a person who stutters too. And I was like, you know, I thought you were, but you're fluent most of the time. So I wasn't really sure. But yeah, we're all over the place.
We are indeed.
Mhm.
And increasingly, I think, you know, and the more of these examples that people that stutter hear about and realize, you know, the more I think, the more of us,
Mhm.
you know, that you'll see,
Mhm.
because that old that I like to call it the stuttering wolf, that voice in our head saying you're not good enough, you can't do
Yeah.
it because of your stutter.
Mhm.
The more people will learn to ignore that voice and
Mhm.
say, yes, I can do it.
Mhm.
I'm going to do it. And
Yeah.
and uh, you know, no one's saying that it's easy.
Oh, it's really not, but it's doable. And that's the message that we or people who see this need to take home or should take home. It's hard. A lot of things in life are hard. It doesn't mean they're impossible. And this is something that is hard, but it's worth it, and it's very rewarding. And I always say that, I wouldn't wish stuttering on anyone. I think it's terrible. It's a pain in the butt. Um, but if I had to really choose, like if I could speak perfectly or not, I, as awful as stuttering is, I wouldn't choose to be fluent just because I think it's really impacted who I am as a person, and the type of doctor that I'm going to be for people.
It's a big part of what's made you
Mhm.
who you are, and you
Yeah,
love who
what
you.
makes us, you know, us. Yeah.
That's awesome. I love it. So that was a great chat.
Yeah, it
Katy,
was.
coming near the end, was there anything that you wanted to talk about that we didn't touch on yet?
You know, I feel like we covered a good breadth of things, a large scope of things, and things that I made a note of beforehand that I wanted to really hit on. You know, just I'm thinking back, if I was a little me and I was able to see this, what would I want to know? And I feel like we've covered them all. Just really, there's a lot of power in accepting who you are, and it's hard. But once you do, you're kind of unstoppable. Um, so there's a lot to be said. And also, I think that as humans, we care a lot about things that aren't important sometimes, about interactions that are fleeting. And I think that we have a limited amount of caring that we can do because it's draining. And if you can work on it, something that I really work on, be selective with what you choose to really care about. Do you really care that somebody made an uncomfortable face as you stuttered? I mean, yeah, like you probably do. It's awful. It may be embarrassing, but in a day, will that be an interaction that is important, that impacts you? No. In a week? No. In a year? No. In in an hour? No. So that's how I really try to approach things. Like, is this something that I think is going to be important in the long run? If not, especially with speech, let it go. And it's so freeing.
Exactly. And what matters is what you're saying, right? Like
Yeah.
it's
Yes, of course.
communication, it's
Yeah.
connections with people that you
Hmm.
have. It's not the stuttering that was
Hmm.
central, in what
Exactly.
happened there.
Yeah, it's what you say, not how you say it. And I've been blessed with family and friends who treat me that way, and I make sure that I surround myself with people who don't care how I speak, but they're listening to my words and intentions. And that's something that I think that people who stutter, we can choose who we engage with. Choose to engage with people who value you for you, and that is also something that's very freeing.
Absolutely. And that reinforces you or us,
Yeah.
remember that, you know,
Mhm.
we are people of value, you know.
Yeah, we are. And
Absolutely.
stuttering is awful, but it is what it is, and you will be fine. It will be fine.
I think yeah, I'm always looking for titles, and it is what it is one of my favorite
It is
phrases
what
in
it is.
general in
Yeah.
life.
Mhm.
Uh,
It is.
right? It's a stutter. Nothing more, nothing less.
Mhm.
You're saying it's easy, but it's not
What it is.
defining of
Yeah.
us,
It's not.
right?
Yeah. We because it's something that is so like centric to just what we think about. I think that it can like be entwined in how like we perceive ourselves, like who we identify as. Um, and like you said, it's stutter. Like it's not more, it's not less. It is what it is. And that's something that's so important to realize, and to really like take home. Just it is what it is.
Amen. I totally agree. Great conversation, Katy. Thank you very much for joining me and for like your journey uh, that you've lived and that you shared with us today. I know will resonate with a lot of people, and
Yeah.
just what you've done. Going to
Mhm.
Stanford, becoming a doctor, living your life. It's
Mhm.
not stuttering's not preventing a great life here. So that's
Mhm.
awesome.
And thank you so much for inviting me. I think that conversations like this are meaningful. And even if people don't see this, I feel like that this was good for me. It's always like a good reminder of who I am and what my values are. And so I really appreciate you reaching out. And this was great. So thank you.
Absolutely. Well, we'll talk to you soon, I'm sure. Let's stay
Yeah,
in
of
touch.
course.
Take care.
Same. Goodbye.